Hello, I am Dr. R. Constance Wiener. I am an associate professor in the Department of Dental Practice and Rural Health in the School of Dentistry at West Virginia University. My co-authors on this poster are Dr. Ruchi Bandari, an assistant professor in the Department of Epidemiology in the West Virginia University School of Public Health, and Dr. Alcinda K. Trickett-Shockey, a professor in the Department of Dental Hygiene at the West Virginia University School of Dentistry. We report no conflicts of interest related to this research. The title of our poster is Mortality Incidence Among Older Adults with Unhealthy Opioid Use and COVID-19. Older adults are inherently compromised for contracting diseases. Unhealthy opioid use could increase adverse outcomes of such diseases. The combination of unhealthy opioid use and COVID-19 can be fatal. The purpose of this research is to determine an association between unhealthy opioid use and mortality in adults ages 65 years and above following their COVID-19 diagnosis. Our data source was the TRINET-X system. From it, we identified patients with COVID-19 exposures from January 20 to September 25, 2020. Our statistical analysis was carried out with the TRINET-X software. We calculated mortality incidence. We compared the risk of mortality occurring between 7 and 90 days post-COVID-19 exposure among patients with and without unhealthy opioid use. Our sample included 4,584 COVID-19 patients with unhealthy opioid use. Their mean age was 72 years. 56% were female, 72% were white, and 21% were Black. Our sample also included 312,256 COVID-19 patients without unhealthy opioid use. Their mean age was 74 years. 53% were female, 74% were white, and 14% were Black. Of the total, 6,924, or 2.19%, died within 3 months of COVID-19 diagnosis. The risk ratio for the cohort with unhealthy opioid use compared with the cohort who did not have unhealthy opioid use was 1.39. The 95% confidence interval was 1.17 to 1.64. We know that COVID-19 remains a major concern for all individuals, and older adults are particularly vulnerable. From this research, we conclude that among older adults, the older adults who have unhealthy opioid use are at increased risk of death after exposure to COVID-19. This research was supported in part by the National Institute of General Medicine Sciences of the National Institute of Health. Thank you for your interest in our poster.